Hello, everyone. My name is Michelle Hay. I'm Director of Acupuncture at Boston IVF. I've been working since 2006 at Boston IVF. My background is that I went to the New England School of Acupuncture, which is part of MCPHS, the Massachusetts College of Health Science Pharmacy. Massachusetts College of Pharmacy and Health Science, excuse me. So I work at Boston IVF on Wednesdays and Fridays, the first weekend out of every month. There are 4 acupuncturists in total that work there. We cover 7 days out of the week. We do acupuncture appointments, follow-up appointments, and then we also do appointments that are around your cycle, right? So around the time of your transfer, around the time of your IUI, and we coordinate. My webinar today is to focus on, I'm going to give you a brief blurb of what the world of acupuncture does. What do I do? What do we do at Boston IVF? I give you a little bit of my background, and then I'm going to answer questions. I have a half a dozen questions that have been sent in ahead of time. I'll answer those, and then I'll move on and answer some of the live stream questions. So I know there's copious amounts of information out there on the internet. I imagine the majority of you already have an idea of what acupuncture is. These are small, single-use, fully disposable sterile needles that are inserted into a variety of points in the body: head, abdomen, arms, and legs. When you come into an acupuncturist, especially at Boston IVF, we do a full intake. We ask you about a variety of things, obviously focusing on your fertility needs, where you are in your cycle, if you're naturally trying to conceive, if you're participating in reproductive endocrinology. We're very well schooled, obviously, because we have this integrated program with the nursing staff and obviously with the physicians there. So we're well versed. You can speak to us about any number of things that are going on in your cycle and ask us appropriate questions. So we focus on that, but then we also speak about how's your sleep? How's your digestion? What's going on? The world of Chinese medicine really focuses on system interconnectedness. We do need to know about your digestion. We do need to know about your sleep. It heavily influences your endocrine system, right? Your pituitary, your thyroid, your ovaries, those work together. What we try to do after an initial appointment is that we work to do almost a preconception plan. Where are you in your cycle? What's working? How much time do we have to work with you? And we just openly discuss. All right, let's talk about schedule. Let's talk about timing, and then we'll discuss a plan. We'll talk about a strategy. I fully appreciate time and money as well, so I'm quite open in discussing with patients. What does your schedule look like? Is this feasible for you? And how can we get this acupuncture to be part of your program and moving forward with your reproductive endocrinologist? Or if you're naturally trying to conceive, you're potentially not cycling, or you're not in that reproductive endocrinology world, we'll work with you based on where you are in your natural menstrual cycle. We look to customize our treatment strategy. And this is the tricky thing about traditional Chinese medicine, right? There's lots of studies that are out there in the world, especially drug studies, clinical trials, things along those lines. They have very rigid parameters around them, double-blind placebo studies. The world of Chinese medicine is having a moment here where it's looking to evolve, and it's having some difficulties, because you really want to customize your treatment strategy to your patient. And sometimes that makes it difficult to standardize. One of the most common questions I get as an acupuncturist is, well, how does it work? What does it do? We know in looking at clinical studies where you stick an acupuncture needle in a patient and you stick them in a functional MRI machine, we know that it lights up different parts of the brain. You can see it on functional MRI. We also know that in certain points in the body, specific to the abdomen, there have been clinical studies that have ultrasounded in the abdomen, and you can see vasodilation. You know that it moves blood flow. So we know from the Western medical world that acupuncture innervates you neurologically, and we know that it innervates things from a vascular system. Very commonly, when I have patients that come in for a pre and post embryo transfer acupuncture appointment, right? So it's the day of your transfer, you're coming in, I see you 30 minutes beforehand or 40 minutes, and then I see you after. My three clinical goals are to invigorate blood flow into the uterus and endometrial lining, to mitigate spasms and cramps by relaxing that uterine muscle wall, to help you feel more calm and more grounded. So as you can hear, my perspective is, yep, I'm looking to innovate you from a brain standpoint, from a neurological standpoint, and at a local standpoint, distal and local. When I have the opportunity to see patients just for regular follow-up appointments, where that is not specifically on the day of their transfer, there's a number of other things that I take into account. I do a differential diagnosis. So in my brain, I have an algorithm that goes through. I ask you all these questions about your sleep and about your digestion, a variety of other things, your energy, your body temperature, and it goes into my algorithm in my brain, and I have a differential diagnosis that comes up, and I treat you accordingly. So I've spoken about two very different appointments there. I've spoken about on the day of transfer, which we have a protocol-based acupuncture treatment strategy that we utilize on that day. I have some patients that I have seen consistently for acupuncture on the day of the transfer, and then I have other patients that I see on that day, and I haven't seen them before, or they haven't even had acupuncture before. So we talk you through the entire program. I also know that there's lots of questions regarding clinical studies and clinical trials about acupuncture, and those are out there, but they tend to be very small. They tend to be West Coast focused, and they tend to be in Asia and Europe. The clinical trial base, again, I'm going to harken back to my previous comment about each acupuncture appointment is customized to the patient, which makes it difficult to standardize. So speaking about clinical trials and about, what is the data? At Boston IVF, we don't do any clinical tracking as of yet, but that's something that we're looking to evolve and hope to do in moving forward so that we have more clinical data to present to you with, and also continuing to pull data from meta-analysis and studies that are going on throughout the world so that we stay clinically relevant and up to date. From an acupuncture standpoint, as a clinical acupuncturist, you have to be licensed through the state of Massachusetts. You have to have a master's degree level of education or higher, or a doctorate. You have to carry malpractice insurance. You have to participate in continuing education. The interest in continuing to stay current and updated and evolving is what we are looking to do at Boston IVF. The four acupuncturists I'm one of the four, the three acupuncturists that I work with, we have a fantastic amount of clinical experience. We've been doing this since 2006. We work 7 days a week. We have seen a variety of different patients and also watched the world of reproductive endocrinology evolve, which frankly has been fantastic. Right, so common patients who I treat: patients with PCOS, patients with endometriosis, patients with diminished ovarian reserve, premature ovarian insufficiency, commonly treating patients that have unexplained fertility. Also supporting the female, if you are in a heterosexual relationship, the female aspect of a male factor-based fertility issue as well. We typically focus and see mostly females, to be perfectly honest with you. We don't see a ton of males. One of the most common questions that I get, especially with males, is that we treat the entire body. We do not stick needles in your genitalia. So just to be clear about that, we are welcoming to men as well, because male factor infertility is a real issue, focusing on sperm production, quality of sperm, and motility. I'm going to come back to a couple of questions that I have written down here. Excuse me, let me flip my page here. One of the main questions that I had to start was, does Boston IVF have any concerns with acupuncture during the IVF process? No. There's no contraindications. There's no concerns, medicated, non-medicated. Acupuncture is overwhelmingly safe. We treat patients cycling, during the cycle, even during the 2-week wait. We are fortunate enough to be able to treat many of our patients through pregnancy and through postpartum. And at this point in my career, because I've worked at Boston IVF for so long, I have now started to see patients come back to me for perimenopausal and menopausal symptoms, which I understand is not critical during the time period of participating in fertility treatments, but it also shows the arc of what we treat and how we look from a hormonal standpoint, from an endocrine standpoint, that we treat you throughout the entire curve. And it's highly applicable to return to us. Data, I've already alluded to the data thing. It's complicated to get funding for a large scale acupuncture study here in the United States. I am not someone who participates in studies. It is not my forte. I know at MGH, they currently have a study going on. They had a study pre-COVID that was looking at pain management. So again, I know that's not fertility based, but if I could get the data gods out there to move forward with a study from the world of fertility, I would be thrilled. Anyways, I'm stuttering and hovering. Let me move on. Location. Our location is in Waltham, in Massachusetts. We currently do not have practitioners at the numerous interstate sites that we have in the United States. There are some references, so we do have some referrals that we can give, but we don't currently have a good network, something to work on. I do understand that. So I do understand from our social worker standpoint and from our registered dietitian, they might have more options because the wellness center is composed of acupuncturists, but also the social workers and the registered dietitians as well. They might have different parameters based on their license. If they can see people from out of state, that would be something to contact our wellness center directly about. I know, I think Hillary Wright, our registered dietitian, has more flexibility on that front. But again, please contact our front desk. Specific acupuncture points, specific points specific to fertility. There are acupuncture points on the body that do focus on gynecological health well-being, invigorating blood flow to the uterus and endometrial lining, focusing on ovarian health and well-being. If you're coming in for endometriosis, we're definitely looking to decrease that inflammatory process, to move blood, to help with pain management. We're really looking to support the organs and the tissues, right? When I speak about vasodilation, so opening up blood flow to get those ovaries to function at a higher level, to look at that endometrial lining. Something that we commonly treat is thickening the endometrial lining, helping patients who are going through a thaw cycle, especially where they're on a little bit of estrogen, they're doing a little bit of this, but they need that endometrial lining to grow. That's something that we commonly treat. So fourth question, does acupuncture work for both natural conception and IVF support? Absolutely. When you come to us, we treat you where you are. Are you trying to actively at home? Do you need a little bit of help with cycle regulation? But most of the time, by the time you're coming to Boston IVF or the time you're coming to me, you've been actively trying at home. You need that little bit more help. And you need that information from the reproductive endocrinologist, from the team as well. So most of the time, I don't see patients who are strictly naturally trying to conceive. I do treat patients in between their cycles. Say you're having a hysteroscopy that's scheduled, or say you have to have a polyp removed and you have a window of opportunity to actively try at home. That's the time where I'll say to patients, okay, let's work on this. Let's try to capture that ovulation. Let's try to optimize this opportunity. Because the way that Chinese medicine works is we're trying to get you to be the best version of yourself. I'm not injecting you with anything. I'm not a reproductive endocrinologist. I'm not doing any of those things. I'm trying to get your body to be the best version of itself. You know, what's deficient, what's down here, what's excessive, and how can we get you somewhere in the middle so that you can function better? Again, I'm going to come back to your pituitary, your thyroid, and your ovaries. They work together rather harmoniously most of the time, but sometimes that doesn't happen. So if I can work with a patient and we can regulate cycles, we can optimize that. I can work with a patient who has endometriosis and we can decrease some of that inflammatory process. this sets you up so well for moving forward with a cycle, excuse me, the working with your reproductive endocrinologist, perhaps participating in an IUI. We just set you up so that we can optimize your cycle and you can have the best chances that you can. Right. Do I treat through pregnancy? That was another question. Yeah, we do. We treat during that 2-week time period of waiting. Most of the time, if I see you on the day of transfer, I will recommend patients to return somewhere within 2 to 7 days after they have their transfer. We try to capture that early time period. Also, man, your 10-day time period of waiting, or 10 or 12 or 14 days, depending on where you are in the spectrum, it's extremely stressful. Sometimes people in your supportive world, they try to say the right thing. And maybe they don't know what to say, or maybe you don't know what to say in return to them. I also know that all the way up until you have a transfer or an IUI, there's blood work, there's ultrasound, there's constant feedback. And there are also people who are speaking to you and checking in on you. That stops during that time period. Acupuncture is a very safe thing for you to do, to come and participate in, which helps bridge that gap as well. I mean, we obviously treat you physically, mentally, and emotionally, because all of those things matter. I'm not ignoring the physical stuff. I'm just speaking specifically during that time period of waiting. It's really challenging. And so we support you through that. Right. I have a number of questions I know have come out to me. I'm going to just take a quick look over here. Should everyone going through IVF do acupuncture? How do we ask for it? Right. So we have a fabulous woman at our front desk, typically Robin Lasky. She is our coordinator. She's in charge of all of our schedules, and we would be lost without her. She's there. Sorry, I'm pausing. She's there Monday. I almost said 8:30. She's there Monday through Friday from 9 a.m. until 5 p.m. You can phone the front desk. You can phone her directly. We don't do email appointments. We don't do online appointments because it's so challenging. Most of our schedule is, so we have regular follow-up appointments. You can come in for one of those. And then some of the other appointments are depending on the transfer schedule of that day. So we don't offer online appointments because of that. You have to phone Robin, but she's fabulous. She'll call you back. She'll speak to you about insurance. We don't presently bill for insurance. It's not a question of if we take acupuncture, we take insurance. Most of the time, it's if your insurance covers acupuncture. That's a question I get often asked. Robin Lasky, our fabulous patient care coordinator, she does codified receipts. We've had far more success having patients get a receipt from us, submit the receipt to their insurance, and then get reimbursed that way. Or flexible spending accounts. We participate in all of that type of stuff. Listen, I'm the acupuncturist. I've drank the Kool-Aid, right? I've worked at Boston IVF since 2006. I absolutely think that every patient who comes through that door should have support from us, from an acupuncture standpoint, from a nutrition standpoint, from a psychological standpoint. There's two things that are very real in this world, and it's time and money. I would love to see each patient anywhere from 2 to 3 menstrual cycles before they even start treatment, before they even start doing a retrieval, because that's the time period that I really want to capitalize. That's not feasible for most people. That's not always realistic. For some people it is, but for others it isn't. I also fully appreciate you have blood work, you have ultrasounds, you have hysteroscopies, you have HSGs. There are so many appointments that this becomes a long and protracted experience. You want your acupuncture experience to be something that makes you feel better, not something that you think, oh my gosh, I have another appointment. I have another appointment. I have something else that I have to figure out how to get into my schedule. And that's really stressful. That's not what we're looking to do. So we try to make it as easy as possible. If you can come and see us on the day of your transfer, fantastic. Come and see us on the day of transfer. We treat you physically, mentally, emotionally. I'm going to come back to my 3 statements before. We're invigorating blood flow into the uterus and endometrial lining. We're looking to mitigate spasms and cramps and relax that uterine muscle wall. We're looking to help you feel more calm and more grounded. On the day of transfer specifically, we treat the patient. We don't treat the embryo. I have patients that'll come in and will ask me questions about that. The embryo at that point has its own destiny, right? Its own genetics. I leave that all up to the embryology team. We are not embryologists. We treat the patient who's in front of us, which is a wonderful opportunity for us to capitalize on where you are, to have you be in the best place possible. If you are one of those patients that we can see beforehand, 2 weeks, 4 weeks, 6 weeks, we'd love to work with you beforehand. The world of Chinese medicine is very proactive versus being reactive. The goal is to get you in the best place that you can possibly be, to have you move forward with that healthy, happy cycle. I almost use the expression fluff and buff, because that's something that I'll say to patients often. We're going to fluff and buff you. We're going to get you all set and ready to go on the day of transfer, especially. Oh, right. So this is another individual who's speaking about that they're coming in for an acupuncture appointment tomorrow, either here or someplace else, and can it help with implantation? We do typically see patients during that time period of waiting, post-transfer, right? That 10-day time period of waiting. And that's what we focus on. The focus is on the individual, right? The recipient, invigorating blood flow to the uterus and endometrial lining, relaxing that uterine muscle wall, mitigating spasms, cramps, anything that could be an issue post-transfer. And let's also not forget the side effects that you have from the medications that you're on, where you're talking about progesterone and estrogen, constipation, bloating, fullness, decrease in appetite, sometimes nausea, sometimes patients get headaches. There are a variety of things that can make you feel so unlike yourself. These are all things that are very commonly treated through acupuncture. So, excuse me, I'm going to come back. When another question that was asked is, when during egg retrievals do you suggest getting acupuncture? Do you see it beneficial for a retrieval process? Yes. So if you're able to come in ahead of time, ideally we would get to see you before you even start your stims, right? But depending on where you are, if you've started your stimulating medication, come in. Most of the time, now I'm giving estimates here. I'm not a reproductive endocrinologist and never pretend to be. I'm going to give guidelines, timelines. Most of the time, patients stimulating medications, if you're in a retrieval cycle, anywhere from 8 to 10 to 14 days, right? There's a whole gauntlet. During that time period, we'll see you probably 3 times. We see you the first, we'll see you after you've had some type of feedback in regards of how things are going, follicle development, ultrasound, some type of blood work. And then we'll typically see you towards the end as well to try to move things along. What's growing, what's not growing, what are the side effects, what are the symptoms, excuse me, what's not happening, and how can we work on that? So it's very common that we treat patients. If we get to see you the period before you even have your retrieval cycle, even better, super, because I work on, if I get to see you before you even have a period, I get to see you before from a hormonal standpoint. Your body is so amazing, right? Your body is thinking about ovulating 2 cycles ago, 3 cycles ago, right? When you have a period, your body starts to rebuild its endometrial lining 2 days into your period. It's already starting to shift. The luteinizing hormone is already starting to shift. You're already starting to think about cultivating that next follicle, that next growth, that next cycle. Your body's amazing. And so we try to capitalize on that and try to catch you. If I can catch you before you even have medications on, I'm seeing you at your baseline. And so that's something that I truly appreciate, because from the world of Chinese medicine, I get to see you constitutionally. What's deficient, what's excessive, how do I bring it into the middle? And then also, I'm not chasing some of the other side effects from the medication, which are very real things. Some of the stim meds make you feel so bloated. Progesterone alone can give you constipation, a variety of things. There's another question that's coming up to me that's saying acupuncture working during premature ovarian insufficiency. They're being patient, but it's slow to respond. And what can you do? So people are complicated. I don't think I need to tell you that, but I'm going to give that blanket statement. And there is definitely a range, there is a spectrum. This is multifactorial. When you're talking about things like diminished ovarian reserve, premature ovarian insufficiency, there's a whole spectrum of what that looks like. The consistency of coming for treatment and hopefully coming again before I get to see you, before you have that retrieval, and investing time into utilizing acupuncture ahead of time is where you're going to see the best results. But also working with your reproductive endocrinologist and then focusing on those things. As an acupuncturist at Boston IVF, I have an email address. You're welcome to reach out to me directly if you want to ask acupuncture specific questions. Cycle specific questions, I really do have to refer you back to your nursing team, to your physician, because the specifics of those things are so individual. This is a valid question. Is it possible for acupuncture to negatively impact your reproductive system? No. And the reason why I can confidently say this is because I can't get your body to do something that it wouldn't do naturally. Acupuncture, time and time again, has been proven to be overwhelmingly safe. I cannot, an example that I'm going to come here. I have patients that will say to me, I want to get my period early. I want to ovulate earlier. I want it because I have time. I have the cycle that I want to do. It needs to align. And I'll speak very openly and say, unless from a hormonal standpoint, if your body is not naturally following that pattern, I can't get it to do something that it wouldn't naturally do. I can't make you ovulate if you're not already ovulating. I can't shift it earlier or later because of that hormonal cascade. Depends on when you got your period beforehand, and then subsequently what your luteinizing hormone is doing. I can optimize that. I can move things along. Very routinely, I will have patients that will come to me that have some dysregulation, patients that have PCOS, or some issues with ovulatory dysfunction. And I've been very pleased to see how that has regulated and moved along. But it does take time. But I can't negatively influence anything. Once again, I'm not injecting you with anything. I can't get your body to do something that it wouldn't naturally do. Endometriosis is something that we commonly treat, and I'm going to come back to that. I know I alluded to PCOS as well. We do run the gamut. We've been so fortunate to work with such fabulous physicians, the nursing staff, the APRNs, the ultrasonographers. There's not a single person that I haven't asked a question to, because I will have a patient that will present to me with something and I'll think, I don't know the answer to that, but I'm going to go find it out. Then the nursing staff, I actually share a hallway with a couple of APRNs. Every single shift that I work, I'll pop my head in and I'll say, Liz, I got a question for you. And if she doesn't know, she finds out as well. I routinely email the physicians, will ask specific questions, and there's open communication. So, excuse me, there's a question that just popped up just now that says, can acupuncture help with conditions like PCOS? Yes. The way that we look to help with PCOS is regulating hormonal function, helping to get a more regular cycle. Now, I'm a huge advocate of working with Hillary Wright, the registered dietitian, if you have PCOS. I know that there's a whole spectrum for the world of PCOS, but I cannot stress enough that PCOS, polycystic ovarian syndrome, is a metabolic issue, and it needs to be addressed on multiple fronts. The world of Chinese medicine is absolutely fabulous. It can treat numerous aspects of PCOS, but it can't be the only way. Because it's a metabolic issue, you really do need to work with a clinical nutritionist as well. Sorry, a registered dietitian. I pause there because I know that there's a difference between a nutritionist and a registered dietitian. You need to work with a registered dietitian. And Hillary Wright is my go-to. She's written books. She works at Boston IVF. She's absolutely fabulous. We look for hormonal regulation and helping you work with her, and changes in lifestyle as well, to get you back on track, to hopefully get ovulation moving and shaking, but obviously to optimize your cycle, because if you're already working with that endocrinologist, that reproductive endocrinologist, you're looking to have somebody help you more than likely before your cycle and then as you get to the cycle. So to optimize your retrieval and then to move forward with the transfers. So I do understand that I'm speaking about two different situations there. Right. So I know that was half an hour and I went through numerous things rather quickly. Insurance, excuse me. I'm just taking a look here. Can acupuncture help regulate my menstrual cycle? I'm also asked questions regarding insurance. Yes, I've already spoken about that. Regulating a menstrual cycle. So the answer that I'm going to give is it depends. Depends on what's going on with your menstrual cycle. This is something that you come in for an initial acupuncture appointment and we discuss. Because I work at Boston IVF, I can take information from your gynecologist or blood work or things along those lines. I'm not looking to give you any particular diagnosis, but if you come to me with specific information, we speak openly and honestly about that. And then that becomes part of the differential diagnosis that I have in my brain, right? I spoke about it earlier, that I have this algorithm up here somewhere in my brain. So if you're coming to Boston IVF and you're just starting, come with all of your information, and then we discuss all that in your initial appointment. I have had very good success in regulating cycles, but it completely depends on where you are on that spectrum and what the origin of that cycle dysregulation is. And as an acupuncturist, there are plenty of times where patients will present to me that I will say to them, I'm not sure what is going on here, and we've got to get you further tested. We have to get you seeing a reproductive endocrinologist, or maybe you cycle back to your gynecologist and then end up at a reproductive endocrinologist. So I'm not sheepish from referring patients for further help if needed. Unexplained infertility, I'm also seeing a question about that. Yes. I wish I could remember the statistic. There's a very large portion of patients that have unexplained infertility. And it's really frustrating because you think, what the heck does that mean? So many years ago, I was at one of the Boston IVF winter parties, the holiday parties that we used to have. And one of the physicians who worked at Boston IVF at the time, who is now since retired, who will remain nameless, I was standing speaking to him. And we were speaking about unexplained infertility. And he had spoken about a number of different avenues that he thought that needed to further be pursued. And when I had said to him, gosh, that sounds so overwhelming, his response to me was, Michelle, I feel pretty confident that I know 100% of about 30% of what it takes to make a baby. I sat there and I stood there and I looked at him and I thought, wait a minute, your math is totally off there. That's not what I expected to hear from you. And he said, exactly. There's so much that we don't understand. This is how the world of Chinese medicine can come in and give support to patients that come in with an unexplained diagnosis. You come in, we do an initial appointment with you, we do a full differential diagnosis, we customize our treatment to you, we look at physical, mental, emotional. We talk about your digestive tract, your sleeping, your energy levels, and we try to regulate you as much as we can to optimize you so that if you can go home and you can actively try to conceive, that you can conceive naturally. If there's something bigger going on where you need further help, then you work with that reproductive endocrinologist if you're not working with said individual already. And then our job becomes, all right, how do we optimize you for these cycles? How do we get you in the best place so you're ready for that IUI, you're ready for that retrieval, that you have the best results that you can get, that you have a better yield, that you're able to move forward, that your endometrial lining grows, and that we set you up so that you can have the best chances. Oh, this is super. There's an individual who's said that they had an embryo transfer on Tuesday. That's fantastic. That they weren't aware of the acupuncture. I did it right after transfer. Does it have less chance if I didn't do before? So excuse me. You mean the before and after? So the reason why we have the before and after is because it was based on a clinical trial that was done, believe it or not, in 2002. It was called the Paula study, and it it was the largest clinical trial of its time. And it was specifically looking at patients that did acupuncture right before and right after. And we developed our protocol based on that study. Obviously, we've modified it since then and we've evolved. But this is also real life. Real life is not a clinical study. We have patients who come from MGH. We have patients that come from Brigham and Women's. We have patients such as this individual that says, I didn't know, can I still come in? Absolutely. Because we're going to optimize you where you are. Again, you're going to have a practitioner that's going to look at you and say, all right, here's what you need. Here's what we're going to focus on from a post-embryo transfer. And here's what we're going to focus on you from a constitutional standpoint and what you need. And then also to mitigate some of those side effects, the symptoms, so that you just plumb feel better. We work with patients of all different age brackets. We work with patients in their 20s all the way through to their 40s. And we're looking to work with you to optimize these cycles that you have. Coming in for an initial appointment, or you can phone and speak. You can email me, you can phone and Robin, our patient care coordinator, and speak directly if there's something that you have concerns about specific to yourself. But otherwise, making an initial appointment and then coming, so that you have that conversation with the practitioner and that you have that customized, basically your preconception plan that you work with us on. Excuse me, I'm going to come to further questions. There's male factor. How far in advance providing them with a sample is helpful for acupuncture? Right. So this, I will take men as early as they will let me. If they have a sample to come in, I'd love to be able to work with them for several weeks beforehand. I know on average, what is it? Somewhere between 70 to 90 days is a sperm cycle. Don't hold me to that specifically. I obviously need one of the nurse practitioners or one of the docs to speak specific for those days. But we look at it from the life cycle of a sperm. Okay, how far in advance can I get you to come in so that we can optimize this? I have had patients who've come in the past that have dropped in and done one appointment, and I'll think, oh, I really wished I could see you more, so that I could influence that sperm. Let's say in a perfect world, I'd get to see them 6 weeks before. I'd get to see you once a week beforehand. In a not so perfect world, maybe I get to see you a couple of weeks before. With male factor, most of the time they'll have you come in, depending on the male factor, excuse me, not diagnosing, not a reproductive endocrinologist, just to be clear. There's a whole spectrum of the world of male factor. But if I'm able to get working with the patient ahead of time before they give multiple samples, I love to have that, because then you do the first sample, the second sample, and you can see the change and you can see the gradient difference. And that's what I mean by getting you as far in advance as I possibly can. Again, let me come back. Time and money. Those are very valid things. And I know some men are sheepish. They don't want to come in for acupuncture. For God's sakes, I can barely get my own husband to come into me, and I'm an acupuncturist, and we've been married forever. So I do understand how challenging it can be. Right. So I'm going to come. There's a question here regarding menstrual cramps. This is something that is very commonly treated through acupuncture, and I can't speak specifically to this individual because it's unclear of what's going on. Is there an endometriosis component? Is there something else going on behind it? And how long were you participating in acupuncture for? There have been some patients where I have treated so twice a month, 3 times a month, 4 times a month for 6 months, for a year. Depending on what's going on in their life and what they need. And most of the time, that's not what happens. Most of the time, you'll come in for acupuncture for an acute duration. Well, you'll come in once a week for, say, 6 weeks in a row or something along those lines, timing around your cycle, depending on your menstrual cycle. Most of the time, I like to see patients through 2 menstrual cycles. So for 8 weeks, I'll have patients come in every week, and then we spread it out. This can be a long process, participating in the fertility world. It can be far longer than anybody anticipates it. And I'm aware of that. So I space treatments out, but I have some patients that have fairly significant things going on, and I'll treat them acutely, and then I'll treat them twice a month for 6 months, 8 months. So a long duration of time. PCOS, endometriosis, all these big things, tubal blockages. These are pretty complicated factors. And so it takes a multifaceted approach to treat them. You'll always hear me go back to Hillary Wright, the registered dietitian that works with us. She treats patients all throughout this fertility experience. I'm a huge fan of the Mediterranean diet myself. I am not a fan of exclusionary diets. I get asked this quite frequently. Should I cut out gluten? Should I cut out this? Should I cut out that? If you're having symptoms where there's a clear correlation, then I do support that. But removing all these different things from your life and making you feel like you can't do anything, and participating in the fertility world can feel oppressive enough because you don't know when your cycle is, you don't know when this is. So much of your life is dictated by other individuals. And I know there's lots of, other individuals, I mean, by test results or when you're cycling or retrieval or things that you don't have a lot of say in, or hell, even insurance, right? Sometimes insurance can dictate a lot. There's a lot of waiting. I am loath to have patients remove things unless there is a clear correlation that they're having symptoms, you remove this from your diet for 6 weeks or 3 weeks or something, and a number of those symptoms get better. Then there's that clear correlation, and it's very individualized. You'll find lots of things out on the internet that'll say, you have to stop gluten, you have to stop dairy, you have to stop sugar. Now, could we all eat less sugar? Absolutely. There are people out there that have dairy sensitivity that they don't even realize. The celiac disorder is a very real thing. That's a little bit of a different kettle of fish, but that is out there in the world. So choosing I'm going to use a very overused word that I said I wasn't going to do. Holistic? No, I'm going to use the term collaborative, where you have an acupuncturist, you're working with your reproductive endocrinologist. Perhaps you see that registered dietitian. Perhaps you're utilizing the social working team. I know that there's a fertility support group that's going on that meets once or twice a month. Stephanie and Dylan are our social workers that work with us. I can't say enough about them. They're absolutely fabulous. It's on Zoom. You don't even have to leave your house. These things are very accessible. Physical, mental, and emotional are all things that you participate in as being a human individual that get taxed when you're going through these fertility cycles. I cannot speak enough about how stressful this process is. To me, when people speak about self-care and self-care, you'll hear it out in the world of social media, you hear it in a variety of different topics. And I always think, so what do you mean by self-care? Because self-care to me goes far beyond having a bubble bath and getting your nails done. It means being self-aware. It means that sometimes you need to put up boundaries when times are challenging, utilizing the social working team that we have at Boston IVF, looking at stuff that's on the internet and cherry picking things that seem like they would work for you, but then also taking that information back to your reproductive endocrinologist or your acupuncturist or your registered dietitian or the social worker and getting some practical information about how helpful that is to you. All right, I'm off my high horse. I got a question in regards someone on the other side of the state, other practitioners. I do have individuals who I refer to. If you'd be willing to contact Robin Lasky, the patient care coordinator at the Wellness Center front desk, I could provide you with more specific information. I don't tend to put blanket statements out. I like to hear about the individual. I like to get direct referrals. I only refer to practitioners who I know. When I send patients off and say to them, go off and find an acupuncturist, say you live farther away, I'm like, go find an acupuncturist because you need it. It's going to be helpful. I encourage patients to ask around in their community. And something that's fairly straightforward to do is to phone that practitioner and to throw out some lingo. If you're participating in the fertility world and you're doing an IVF cycle or an IUI cycle, or you're doing a donor egg cycle, or a variety of other things, there's lingo that's associated with that. The practitioner who you speak to should be savvy. They should know what PGTA is. They should know what gonal F and menopur and cetrotide and the side effects and estrogen and progesterone and like what type of progesterone are you on? Endometrium, crenone, progesterone, and oil. They need to know that lingo. And if you're speaking to somebody that doesn't know that lingo, you got to move on and find somebody else, because that's somebody who you need on your team. You don't need to spend time explaining to somebody. You need a practitioner who's savvy to this world, because that's how you're going to get the best care. And I know there's practitioners out there in all different walks of life, in all different types of people. But finding that good practitioner that's a good listener, that has good bedside manner, that has the education behind them. You want to make sure somebody's gone to, the Massachusetts College for Pharmacy and Health Sciences in Massachusetts has a good referral program as well. They have a pretty decent network of online individuals to find an acupuncturist near you. You need to find somebody that has that experience as well. Somebody who's actively trying to conceive at home, how often do I recommend acupuncture sessions? Depends on where you are in your cycle and kind of what's going on. Do you have, some ovulatory dysfunction? Are you just actively trying to conceive? What particular age bracket are you in? There's a number of factors. I would say that assumption would be, or the start would be, make an initial appointment and then come in and speak about what your cycles look like. If you have a regular 28-day cycle, maybe we'll see you closer together. Maybe we could capitalize on those 2 periods. But say you're somebody that has a 45-day cycle that's much, much longer, and your ovulation is not quite where you want it to be. Maybe we have to look at it a little bit more long-term. Is there any reason not to do acupuncture? If you don't like it, there's no physical contraindications that I would have. I have patients who have fear of needles who come in for acupuncture. Ellen, one of the other practitioners that I work with, she's a Japanese style practitioner, which means she practices a Japanese style technique, extremely thin needles. She uses less needles. I myself practice a traditional Chinese style technique. So that's an option if you're somebody that has fear of needles. Ellen works with me as well. Lily Kai does. I think Lily also practices more of a Chinese style, but Ellen works from somebody who's needle phobic. I've had plenty of patients that have fear of needles and they still come in. All of these patients, all of these needles are solid. They're not hollow. The patients that have had IV blood draws, you're talking about a needle that's 10 times, 15 times what we're using. If there is blood that comes out when the needle is removed, it is a droplet that is taken care of with a Q-tip. You're not talking 99% of the time when I remove patients' needles, there's no blood. There's no concerns that way. Oh, except for ears. Ears are tricky. There's lots of little capillaries and vasculature in there. Omit that I said that. The ears are tricky. Sometimes I'll get bleeding there, but it's not a lot. Q-tips worth is what I'm speaking about. I have some patients, let me come back to this. I have some patients who have difficulty laying on an acupuncture table. They feel antsy. They don't like it. Most of the time, I will try to encourage patients to be on the table, just listen to the background music and just be there. But for some patients, that doesn't feel good. For those patients, I work with them. Do you have a book? Do you have an audio book? Do you have your own music that you like to listen to? Do you have your own guided meditation so that you can come in and you can be peaceful in your own way? I used to have a patient who would come in with a Kindle, who would read on a Kindle. Now, that's not something that I typically suggest to patients because I really do want you to go in there and just be peaceful. And sometimes when patients ask me for a phone, I stand on my high horse and say, no, you cannot have your phone on the treatment table. But I do get it. There needs to be modifications sometimes. And if you're able to come in and be peaceful and receive the treatment and sustain, and you enjoy it and you leave feeling better, and then obviously the focus is on optimizing from a fertility standpoint, then I want you to come in and we'll try to modify the treatment so that you feel comfortable. Acupuncture helping with egg retrieval. If we get to see you ahead of time, we're looking to nourish your ovaries. We're also looking to get your body to pick up that medication, as in absorb and process and respond to the medications that you're taking, the stimulating medications. I know the docs always speak about quality versus quantity. So that's something from an acupuncture standpoint that we look to try to encourage. IUIs, we treat them as well. There's a question about having an IUI treatment soon. Depending on when your treatment is, make an appointment. We'll try to either see you on that day. If we get to work with you a couple of weeks ahead of time, is it timed intercourse at home? Is it a natural cycle IUI? Is it just that you're using OPKs at home? Is it Clomid? Is it letrozole? Is it perhaps Gonal F? You can hear me going through the whole gamut there. We're well versed and we'll treat you where you are. So come and make an appointment with Robin. Average price for the day of transfer. Day of transfer. Pre and post embryo transfer. I think it's 180, right? Because it's 2 acupuncture appointments. Our follow-up appointments are 100. So we see you for that hour. I know that it is more, but we treat you beforehand, we treat you after, and you have the same, most of the time you'll have the same acupuncturist that day because we wait for you to come back to us. There is a question about endometriomas and cysts. That is something that we have treated in the past, highly dependent on is your cyst, how big is it, where are you in your cycle? I have treated patients that have done IVF cycles and have developed cysts because of the medications, and subsequently having to go sometimes on birth control pill, but we'll treat them through the cycles to hopefully get the cysts to reabsorb. We do focus on that. To throw out a level of complexity. Is it a complex cyst? How big is the cyst? Do you have a history of cysts? Do you have a history of PCOS? You can see it's multifactorial, but that is not uncommon. That is something that we have treated rather readily. Do you share more about acupuncture and Chinese medicine for male partners? I think we've discussed that, treating them ahead of time, looking for sperm parameters, the 3 parameters, the volume, the motility, and the morphology. Clinical studies have looked predominantly at volume and motility for sperm, so we do try to treat male partners for that. There's a question about herbs here. We do not participate with herbs at Boston IVF. This is something that you should speak to your reproductive endocrinologist about. Typically, it is not something that you would take at the same time that you're taking stimulating medications or other medications as well. Be honest, be upfront, get the herbal prescription and speak to your physician about it. See if there's any contraindications. Again, you should be working with a practitioner that understands what you're going through. It's highly patient dependent. And speak to your doctor about it, and so that there's improved communication all around. There's another question about endometriosis and acupuncture. Yes, that's something that we very commonly focus on during cycles and then out of cycles as well. That pain management aspect, the really heavy periods, the intermittent cramps that you can have all throughout your cycles, the chronic pain, those are things that we focus on to decrease that inflammatory response. Because once you have endometrial lesions that grow out, we can't make those go away, but we can get we're looking to downregulate, right? To decrease that pain response, to decrease from a neurological standpoint, and to decrease the inflammation. There's an individual who says that, hello, that especially if I saw you on the day of your transfer, that coming during pregnancy, most of the time we'll treat you once a week until you hit about 10 weeks, sometimes 12 weeks, depending on if you're sick or not, or kind of what's going on there. And then I have some patients who I will treat until 10 weeks. I'll see you once a week till 10 weeks. So that's about 6 weeks, 5 weeks, depending on when you come to me. And then I won't see you again. I'll see you all the way to the end of, when you're about to pop. I have some patients that'll come in intermittently, second trimester insomnia, heartburn can be a reoccurring issue, nausea, which is nobody's favorite, can drop in and out of during pregnancy as well. Again, very commonly treated, no contraindications, extremely safe. I'm not injecting you with anything. So there's no concerns for a baby standpoint. We'll treat patients for musculoskeletal things as well, for hip issues. So you can come back. Listen, once you're a patient of ours from an acupuncture standpoint at Boston IVF, you're always a patient of ours. I like to keep my patients close. I like them coming back to me. I treat patients after they've had their kids. And I know that I've worked at Boston IVF long enough now that I've cycled back to where patients are coming back to me for menopausal symptoms. I love to have patients come back to me. I thoroughly enjoy my work. I think humans are fantastic and fascinating. And I hope that shows in the work that we do. So this is 5 minutes before the end of the session. If there's any last minute questions, I'm happy to answer. I'm going to refer back to Robin Lasky, our patient care coordinator. She's fabulous. Ring her. I have emails through Boston IVF. You can send me an email as well. We're open 7 days a week. There's 4 practitioners. Come in and find that right practitioner that works for you. And we're happy to support you all the way through this process. I look forward to hopefully doing this again because it's been thoroughly enjoyable. I also thank the moderators for this evening. Thank you for fielding all the questions and for also doing the throwing out the information about Hillary Wright, the fertility support groups with Dylan and Stephanie. Yeah, I think that's it. Oh, wait, there's one other last minute question. Have you already addressed this, but are you using acupuncture? Do you need to do a pre and post ovulation set? Pre and post ovulation session. If you're actively trying to conceive, if you're trying to do it naturally, I don't typically try to time it around ovulation on that day. It's too stressful to try to do that. I try to get you during the week of ovulation, but more importantly, it's the consistency that you would have, especially if you're actively trying to conceive at home and we're looking to optimize what you're already doing. We try to treat you throughout that entire, say, anywhere from 28 to 35 day cycle or wherever you are on that spectrum. I'm Michelle Hay. Thank you for your time and patience this evening. I hope that I've answered the majority of your questions. If I haven't, reach out, contact me. I look forward to seeing you soon.